Firstly, I'd like to pay my deepest sympathies to the families who have lost loved ones in this global pandemic, and the efforts of our health workers have been truly inspirational. Yet and all, Minister, we hear this morning on the Sean O'Rourke show the Labour Court deal for the nurses is behind schedule, and I'm hoping that that's something that you are dealing with, because as we know, these have been the inspirational men and women to the forefront of this pandemic. I want to thank our doctors and nurses and paramedics and home support workers and everyone on the front line who have been to the forefront of this. And of course, we've been blessed in Cavan Monaghan to have our Cavan General Hospital and Monaghan Hospital has been the backbone through this pandemic. Unfortunately, we've seen week-on-week increases, and of course Cavan, as of Wednesday of this week, had 634 cases with 388 cases in Monaghan. Cavan being one of the highest in the country's Minister. There's two issues I particularly want to raise with you today, and I'm so conscious of very little time to talk here today, but one being home testing. I have incidences where the referrals from home testing are getting lost in translation. An elderly couple in my area, the husband was taken to hospital and subsequently died, tested positive for COVID-19. His wife was at home, living alone in her home for 3 weeks, waiting on a test. And she had been referred, the home referral test had been made, and her daughter was living in your own constituency actually, and the son is somewhere else down the country, and she was in her home on her own for 3 weeks, and eventually her daughter had to come and put herself at risk, her mother at risk, her family at risk, and take her to her own home in Kildare, and she got tested within, I think, 3 hours of that transfer being made to a different CHO. So I would ask you, I think that's a problem in our own CHO one, the home referrals. And finally, just to say, cancer patients. I have a number of cancer patients. I'm thinking of one particular gentleman, a young man, a wife, 4 small kids, and waiting on an operation in St James's for a tumour. And he has been given no clarity on when that operation might happen, and I'm just wondering, are those operations that were scheduled before this happened continuing to being scheduled, or what the implications going to be? Thank you.